Now, as government ramps up its vaccination drive across South Africa, Pretoria University's Community-Oriented Primary Care Research Division joined hands to assist more than 4,000 people, including those who are homeless, as well as people living in informal settlements, to get vaccinated. Professor Jannie Hugo, who's director of the Community-Oriented Primary Care Research Unit, joins us now. A very good afternoon to you, Prof, and thank you so much for your time. Give us a little bit of background as to how this particular initiative was given birth to.
Yes, thank you very much. Yeah, we've got a long history of working with people, homeless people, people who use substances, basically people who have less access to health care. So as part of that, we've been working with the Department of Health in reaching those difficult to reach people in terms of vaccination, and then particularly homeless people, but then more importantly people who are undocumented actually fell through the cracks of the vaccine drive, and that was then where we started to work with Department of Health, particularly to focus on those people who are undocumented, but you also find them as part of homeless people and people in informal settlements. But as part of a comprehensive access to health care, we are now focusing on giving them access to vaccination, despite the fact that they may not have formal documentation.
I mean, what we are quite aware of is that the electronic vaccination data system needed one to have documents and to actually be identifiable. What was then the fate of those who do not have the documents, and how do you then, I guess, keep track of who they are and the type of vaccination that they may have then received?
Yeah, no, I think that is important, and actually Department of Health took initiative in that, in making it possible to work within the EVDS without a formal vaccination or an ID number or passport number. So what we do is we give them a health record and a health number, which then becomes the identification on the EVDS. So they are part of the EVDS. We do a health check on them, and we issue a patient-retained health record, and we keep all the records in that, and then we have a data system so that we are aware of them, that we can track them, and also do any follow-ups that's needed. So it's all within a controlled, informed system.
And how many people have you vaccinated so far, and in which areas have you been active?
We've started in Tshwane, in the different areas in Tshwane, and then we moved to Ekurhuleni at Tembisa, and now we're very active in Hillbrow and in Johannesburg. Today I think they are in Nana's farm in Soweto and places like that. So we actually have a few stationary places, but then as we negotiate with communities of people who are undocumented, we arrange for pop-up sites where they then mobilize the community, and then we would go there on a specific appointment and vaccinate people. I think we've done in the region of 5,000 to 6,000 people, of which about 60% of them are undocumented. But we also reach other people. I mean, sometimes people who don't have access would come even though they have documents.
This really is a fabulous initiative that you have taken up, and yes, you are part of the University of Pretoria. This may mean that you perhaps are limited to the Gauteng area. Yes, you've gone outside of Tshwane, but are there plans perhaps to have this sort of program replicated around the country so that communities who are outside of Gauteng are also able to benefit from this vaccination drive?
That's important. As a research unit, we also do extensive work in mining host communities in 6 or 7 provinces. And in that area, we are now mobilizing to do undocumented people, because especially around the mines in the country, there are many undocumented people. So we are engaging with the health departments, and we are in an advanced stage of deploying people to places like Northwest, Rustenburg, in the Free State areas, in the Northern Cape, and in Mpumalanga and Limpopo. So different, specifically mining areas, but it wouldn't be limited to the mining areas, but that would be our starting point. And there we work in partnership with the Department of Health, with Anglo-American and others supporting institutions.
And I ask this really to look at other institutions around the country who may be wanting to partner with you. Are you open to that, in the sense that you already have set the infrastructure, you have the relationship with the Department of Health, and other institutions of higher learning may want to tap into that for their particular provinces and communities too?
Yeah, we are working with churches, with the United Nations Office for Refugees, with MSF, etc., but also with other universities, with WITS, and if there are any other institution that wants to work with us, this is really a collaborative effort. It's not something one could do alone, and especially institutions who have relationships with the local communities, because we find that especially the undocumented people have to have a certain trust in you to be able to access the services. So we're really open to work with any partner who are prepared to assist, so that we can roll this out, because this is only the start of something that should go very wide in the country.
You spoke about the importance of relationship and trust. Could this be perhaps a phase one? Now that you actually have a database of people who are undocumented, could this then go further into perhaps working with Home Affairs and ensuring that perhaps they are assisted in whatever ways? Are there plans to go that route, or is this strictly about vaccination for you?
No, we really see the need of a comprehensive health service, basically in line with universal access to health and the NHI. And people on the fringes of society are really important. They have a high burden of disease. So we have a comprehensive approach, but the vaccination drive gives us a specific focus and incentive to move with that. So yes, we are looking at comprehensive approaches. We are looking at working with the Department of Home Affairs. We are definitely working with Department of Health at all levels, national, provincial, and the district level. And we only work as facilitators and as a catalyst to have wider access to essential health care for people at the fringes of society.
Professor Jannie Hugo, a pleasure talking with you this afternoon. Thank you so much for your time and for that update and the work that is being done by the Pretoria University's Community-Oriented Primary Care Research Division.